So loss of previous function in terms of cognition, memory, executive functioning. Okay. So dementia is more common among individuals from 60 years of age and older. And the incidence, that is, the numbers, they rise for more rapidly for clients from 80 years of age and older. Okay. So dementia, previously we used to call this as dementia. So now in the current DSM-4, we are not currently using the word dementia. Currently, we are using neurocognitive disorder. Okay, cognitive deterioration. Neurocognitive deterioration is the word which is being used in place of dementia. So people with a significant cognitive deterioration experience significant memory loss along with loss in cognitive functions such as abstract thinking or language. So the language functions will also get affected. Their abstract thinking will get affected. And sometimes people will also experience changes in personality and their behavior also. So at any given time, around 3 to 9% of the world's population are suffering from significant cognitive deterioration, that is dementia. And the experience of significant cognitive deterioration is closely related to age. So dementia or cognitive deterioration, as currently called, is linked with age. Among so especially among people around like 65 years of age and more, the prevalence is around 1 to 2%. And it increases to as much as 50% among those over the age of 85, as I just mentioned. And like delirium, some forms of this disorder, deterioration result from nutritional, metabolic, or other problems which can be corrected. But most forms of dementia or cognitive deterioration are caused by brain diseases such as Alzheimer's or because of some uh, injury due to stroke. Okay, so which cannot be corrected or which cannot be reversed. And World Health Organization reports estimates that approximately 22 million individuals worldwide are affected by Alzheimer's and vascular dementias. And it predicts that approximately 80 million people will be affected by 2022. So, what are the signs and symptoms of dementia? The essential feature of dementia is the development of multiple cognitive deficits that include memory impairment. And when we are talking about memory impairment, we are talking about retrograde. It can be retrograde amnesia or it can be anterograde memory impairment. So, what is retrograde amnesia or retrograde memory impairment? It is any idea what is retrograde and what is anterograde?
Retro is
Retrograde
regarding
means
the
past,
past.
Yes.
and antegrade means
So,
future.
yes. So, retrograde amnesia is when you cannot recall memories from your past, and anterograde is when you can't form new memories and but still can remember things from before you develop this condition. Okay. So, new memories are difficult to form. So people with dementia, there is a development of multiple cognitive deficits manifested by memory impairment in terms of retrograde or antegrade. And also one or more one or more of the following, I'll tell you what those are, of cognitive disturbances such as aphasia, apraxia, agnosia, or disturbance in executive function. So what is aphasia? These are different types of cognitive disturbances. Okay. So aphasia is a disorder that affects how you communicate. And if a person is suffering from aphasia, it will impact their speech as well as how they will write and understand both spoken and written language. Okay. So that is what we call as aphasia. And then apraxia is another cognitive disturbance, and it is a disorder. Apraxia is a disorder of the brain and nervous system in which a person is unable to perform tasks or movements when asked, even though they can understand the request, or they can understand the command which is given to them to perform a particular task, but they, because of this disorder, they are unable to perform those tasks or movements related to that task. So they are willing to perform the task, they are able to understand the task, but because of a problem in brain and nervous system, he or she will not be able to perform tasks or movements which are required to perform that task. So apraxia is a motor disorder, which is caused by damage to the brain, and which causes difficulty with motor planning to perform tasks or movements. Agnosia is another condition, another cognitive disturbance, which is a symptom of dementia. Agnosia is the inability to process sensory information. So often there is a loss of ability to, so sensory information is something related to your senses, isn't it? So in this, there will be a loss of ability to recognize objects, persons, sounds, shapes, or smells. So all these, sensory information which we get through our senses, that gets affected. So while specific sense is not defective or lost, or nor there is any significant memory loss. It is just that the brain will fail to recognize whatever inputs it is getting from the senses. Okay, so if the person is unable to recognize objects or shapes, so here there is no problem with the eyes. Eyes are not defective, nor is there any problem with their memory. It is that the information which the input which the eyes provides to the brain is unable to recognize that input, and because of which there is an inability to recognize objects, persons, sound, shapes, or smells. Okay, so these are different types of cognitive disturbances. And another criteria is, so first criteria for dementia is development of multiple cognitive deficits manifested by memory impairment, and also one or more of of the cognitive disturbances. So one or more. So it could be just one aphasia, or it could be aphasia and an agnosia. Okay, so one or more disturbances. And next criteria is cognitive deficits. Because of these cognitive deficits, it causes significant impairment in functioning and represent a decline from a previous level of functioning. So how they used to function before the start of dementia, there will be a decline in their functioning. So what are the causes of dementia? So there are different, you can even say like we have different types of dementia, and these types are the causes of dementia. So causes of dementia is Alzheimer's, and it causes almost around 70% of dementias come under Alzheimer's. Vascular lesions in the brain. So because of lesions or some sort of injury in the brain, it leads to reduced blood flow to the brain, which in turn triggers dementia. HIV infection is also one of the causes of dementia. Because of HIV infection, but person might start to his cognitive functions. There might be cognitive disturbance or memory impairment. Head trauma, injury to the head can lead to dementia. Parkinson's disease is also another cause. Huntington disease, Pick's disease. These are some of the diseases which cause dementia. So, so dementia can be accompanied by symptoms of delirium, delusions, depressed mood, hallucinations, or other perceptual problems, even behavior and communication problems. So there are different types of dementia. Dementia can be classified as primary. So I'm using the word dementia for currently, as I mentioned to you all, that the term which we are currently using, the is neurocognitive deterioration. Okay, keep that in mind. Yeah. So dementia can be classified as primary or secondary dementia. Primary dementia are those in which the dementia itself is major sign of some organic brain disease, not directly related to some other organic illness. Okay. So, for example, I was just reading out the causes of dementia, isn't it? So here primary dementia would be Alzheimer's, Parkinson's, Huntington's. They come under primary dementia because in which the dementia itself is the major sign of some brain disease, not because of some other illness such as HIV or injury the person is having dementia. And the second type is secondary dementia. Secondary dementias are caused by or related to another disease or conditions such as HIV or stroke or injury or head trauma. Understood? And what is the physiology of dementia? Dementia are usually considered chronic, continuous, that is progressive. So the disease the severity, the seriousness of the illness increases as the time goes, progressive, and it is an irreversible disorder. And some more additional changes might include there can be like damaged so cortical atrophy in the brain, increased ventricular dilation, and decreased levels of acetylcholine. It is a neurotransmitter which is responsible for memory loss, decreased levels of norepinephrine and other neurotransmitters. Okay, so with this, okay, so in your next lesson, they are covering Alzheimer's and Parkinson's in much more detail. So before going into detail regarding Alzheimer's and Parkinson's, I will just fastly tell you different types of dementias. Okay, you need to have some basic idea about it. So first type of dementia is basically Alzheimer's. Okay, so Alzheimer, as I told you, almost 70% of dementias come under Alzheimer's only. And the core feature is it shows an early onset. So there are like, depending upon the onset, early onset, it can develop prior to age 60, prior to age 60. Late onset could be developed, it can develop around 60 years or later. And risk for developing Alzheimer's increases with age. I'll tell you, I'll go in detail regarding Alzheimer's once I finish with the different type. That's why I'm not going to much detail regarding Alzheimer's. So now next, after Alzheimer, the next type of dementia is vascular dementia. This is the second most common cause of dementia, or second most common type of dementia. Almost 19% of cases account for vascular dementia. And this vascular dementia is more common in men compared to women. And how does this occur? This is caused this type of dementia is caused because of the damage caused to specific areas of the brain, and this damage could be because of stroke or aneurysm. Stroke is the brain stroke. Okay, so how any idea how does this brain stroke happens?
High BP, ma'am.
IBP and
Brain stroke. Yeah, correct.
shock or IBP and flow of
No,
blood, opening of blood vessels and
Okay,
maybe
tell
because
me what happens in heart attack.
I
heart
mean
attack.
One of
Heart
the
attack.
causes of heart attack, not like every type of heart, different causes. So one cause of heart attack would be what?
blockage
Uh,
of
Correct.
yes,
Blockage, isn't it? So
yes.
there will be an interruption of blood flow to the heart that can result in heart attack. The
Yes.
same,
yes,
if there is an interruption of blood flow to the brain, so it can result in lack of oxygen to that part of the brain,
brain.
and that
Okay.
part will die. So that is what stroke is, brain stroke. Understand? Okay. And sometimes what happens, and why this interruption could be because sometimes there can be a clot in the body which might travel. Okay. And like heart, you said blockages. Blockages happen because of the deposits, isn't it? So
True.
similarly, in our brain also, if plaque, because of protein, plaques will start to form in the brain, and that will lead to interruption of blood flow. Okay. So next cause is aneurysm. Aneurysm is rupture of blood vessels in the brain.
Hemorrhage.
So because of rupture of blood vessels, blood will
Hemorrhage,
flood.
madam.
Yes,
Hemorrhage.
aneurysm.
Hemorrhage.
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 Hemorrhage of
It
blood.
is not hemorrhage. It is aneurysm. Uh, Hemorrhage could sometimes be. Hemorrhage is usually because of some injury. You have been in an accident. Okay. Almost similar to hemorrhage. Aneurysm is like almost you can say there is a time bomb which a person carries. There is no prior warning at all. So
Okay.
aneurysm, rupture of blood vessels in the brain, blood will flood the brain, it floods the brain and pushing the blood against the skull, which leads to crushing of brain cells and killing parts of the brain. And when see in the brain, like because of stroke or because of aneurysm, if cells are damaged and if certain parts of the brain dies or you know, then there is no
Good.
reversal. So that functioning will get affected. Okay. So vascular dementia is caused because of this, because of stroke or aneurysm, and there is no warning at all. Suddenly, a person can have a stroke or an aneurysm. So the onset is sudden, abrupt onset of symptoms with fast decline, and
Can we have any symptoms like that? How?
Madam, does it also mean abnormal swelling in a particular blood vessel to the brain?
uh, see, abnormal swelling means if see swelling when we are talking about swelling, we are actually talking about there could be some sort of an infection in the brain, isn't it? And pus is forming in the brain. But so that if I'm going in that direction, we are talking about some sort of an infection, bacterial or there is a we have brain fevers. So that condition can be cured. Okay,
Sometimes, ma'am, the
in
abnormal
certain
swelling can.
conditions, sometimes there is sometimes it leads to death also. Okay,
Okay.
but that is like the symptoms would be more of delirium like symptoms would be there. So if the doctors are able to cure that condition, that swelling of the brain because of infection, which leads to edema, that is pus and all that. If doctors are able to take care of that, then that the hopefully like the normal functioning gets restored because the brain is not dying in most of the cases. I mean, this killing brain is not dying. I'm saying that part of the brain basically. Got it? So here, the certain parts of the brain they get damaged in stroke because oxygen supply gets stopped. Okay, so which leads to cells dying at that part. So they cannot reverse uh, whatever like damage has happened that cannot be reversed. See, this is my this is what I like understand it to be. Okay, so I might be like as I'm not a medical doctor, so maybe all of I mean my suggestion is maybe read up on this. Okay, so the symptoms there is an abrupt sudden onset of symptoms with fast decline, and if the parts of the brain which are not affected, normal functioning is whichever part is not affected and whichever functioning they are responsible, those functioning will not get affected. And next type of dementia is dementia due to HIV. So researchers have found that HIV can result in destruction of brain cells. And this is where like, yes, your answer, infection. I told you now. Yeah, so the swelling of the brain is because of infection, bacterial viral infection. So HIV, here what happens? If there can be swelling or edema is caused, or inflammation can also be present. Okay, and that can lead to atrophying of certain parts of the brain. So When you're talking about swelling, we are talking about infections. So it can, because of this, it can lead to delirium-like symptoms. Okay, the person might start to, consciousness will get affected, attention, hallucinations. So almost psychotic-like phenomena can also be observed. 30 to 60% of untreated AIDS HIV patients will develop dementia. Only 20% of HIV/AIDS patients who receive antiviral treatment develop dementia. Rest of them are able to, they are safeguard. I mean, it provides a safeguard against developing dementia if they are under treatment. Huntington's disease, another type of dementia. It is an inherited disease caused by autosomal dominant gene. So unless and until you carry this gene, this gene, you will not have this type of dementia, that is Huntington's disease. So 100% this is determined by your genes. That is, if you have genes for it, then only you will develop Huntington's disease. And age of onset is around 35 to 45 years of age, very early age of onset. Okay. And there is a symptoms are there will be a very progressive deterioration of motor skills, deterioration of personality, cognitive functions, and mood. It results in death within 10 to 20 years of developing the symptoms. So, age of onset is around 35 to 45 years. And once the symptoms start to show themselves within 10 to 20 years, symptoms, as I told you, there is rapid progressive deterioration in motor, personal skills, personality skills, cognitive functions, mood. It results in death within 10 to 20 years of developing symptoms. Parkinson's disease, it is a slowly progressive neurological disorder. It is more common in men. Age of onset is typically 50 to 70 years of age. Although sometimes symptoms can be seen as early as in 30s also. There is a famous actor. Heard about Michael J. Fox? Michael J. Fox, American actor. He's been diagnosed with Parkinson's and he started to show symptoms around 30 years of age. What are the symptoms? It causes rigidity, tremors, lack of balance, diminished small motor control, and difficulties in communication. It is caused by both genetic and environmental factors. 20 to 60% of cases result in dementia. So with this, we have finished your dementia. Okay, now I'll be talking to you in depth,
Ma'am,
in
one doubt.
detail. Yes?
Ma'am, you just singled out HIV also as being one of the cause of dementia.
Yes.
Can we also say that tuberculosis and diabetes also is reason for dementia in some patients?
No.
Okay.
Tuberculosis,
Yes, ma'am.
see now, that if that see, tuberculosis is different parts. The TB, there can be TB related to different parts of the body. Okay, so nowadays we have very good medications where 100% treatment is possible. So before the damage, the brain starts to get affected, these treatments, they'll start to kick in and will stop the damage, isn't it? See, any damage to the brain cannot be reversed. So, but
Okay.
before that stage occurs, we are able to do something about it. Okay.
And second question is when we talk about HIV, do pharmaceutical medicines also be a cause of dementia?
Uh, See, we have the under different types of dementia, or
Okay, ma'am.
sometimes certain for example, excessive alcohol usage. Okay,
Okay.
so excessive alcohol usage leads to what we can call as you know, uh, there is a deficiency of vitamin B. Okay,
Okay.
because of this vitamin B deficiency, dementia-like symptoms can be observed, like memory loss, cognitive deficits. But
Hmm.
the moment the doctors are able to, I mean, the person is able to correct this deficiency, they revert back. So it is not damage to the brain is not happening. It is deficiency of vitamin B. Symptoms are
Okay.
similar to uh,
Okay.
dementia-like symptoms. Understood? I hope I've answered your question.
A part of it, yes, ma'am.
And there are certain psychiatric medicines
Yeah.
which can like again uh, trigger dementia like symptoms. Okay, and
Okay.
if if the wrong type of medicines or wrong type of dosages are given, so Parkinson, similar to Parkinson like symptoms are observed. So if
Okay.
they go to a proper doctor who's able to identify and understand like what is being given and is able to correct that dosage or stop those dosages, the person will come back to their original state.
Okay.
Okay.
Thank you, ma'am.
Yeah. So now coming to Alzheimer's. So, Alzheimer's disease was first identified in 1907, and it is the most common form of dementia, accounting for as many as two-thirds of all cases. Okay, and almost you can even say maximum number of cases they fall under this type of dementia. This this gradually progressive disease sometimes appears in middle age. That is, we call as there can be an early onset, but most often it occurs after the age of 65. Its prevalence increases markedly among people in their late 70s and early 80s. So the time between onset and death is typically 8 to 10 years, although some people can survive as many as 20 years from the onset of symptoms. And it usually begins with, how the symptoms, how they start is, they usually begin with mild memory problems, lapses of attention, and difficulties in language and communication. So it starts with mild memory problems. And what is the DSM-5 checklist? So, neurocognitive disorder, that is dementia due to Alzheimer's disease. The checklist is the individual should meet the criteria for dementia. Okay, criteria for dementia is as we just mentioned right now. There will be memory impairment in terms of retrograde or antegrade, or cognitive disturbances like agnosia, apraxia, like that, and it will lead to significant decline in the person's function. So this criteria for dementia has to be met. And second checklist is memory impairment is an early and prominent feature. The early symptoms which are seen are, uh, you know, uh, there will be memory impairment or memory loss. And symptoms should not be due to other types of neurocognitive disorders or medical problems. The symptoms should not be due to other types of dementia, that is Parkinson's or Huntington's and all that, or because of any medical problems. Okay, this is the DSM-5 checklist for Alzheimer's. And as the symptoms worsen, the person will has trouble completing complicated tasks and remembering important appointments. And eventually, sufferers also have difficulty with simple tasks. Distant memories are forgotten. So, they'll forget, like, in old age. So they'll forget that their spouse is no more and waiting for their spouse. Distant memories are forgotten, and changes in personality often become very noticeable. Their personality changes would be very prominent, will become very irritable, suspicious, paranoid. So as the symptoms of dementia intensify, in Alzheimer's, people show less and less awareness of their limitations. So eventually, they become fully dependent on other people. They lose almost all knowledge of the past and fail to recognize the faces of even close relatives. Alzheimer's victims usually remain in good health So their physical health I'm talking about. So they usually remain in good health until the later stages, that is the last stages of the disease. In most cases, Alzheimer's can be diagnosed with certainty only after death, when structural changes in the brain can be fully examined after the death during postmortem. Okay, so what are the causes? So, when they did postmortem studies, they found that, people with Alzheimer's, uh, plaques were observed, that is deposits of small molecule known as beta amyloid protein. That is, don't go into all that detail. So the plaques or deposits of a form of protein were observed in their uh, brain, and this that so these plaques were observed to form in the spaces between cells in the hippocampus, cerebral cortex, and certain other brain regions and blood vessels. Okay, so neurofibrillary tangles were also observed. They are basically twisted protein fibers, okay, which were found within the cells of the hippocampus. So these were observed in patients postmortem studies of brains of patients with Alzheimer's. So what are the genetic causes of Alzheimer's disease? It's seen that it appears that Alzheimer's disease often has a genetic basis. So clinicians, they distinguish between, so if there is an early onset before 65 years of age, then there is a clear-cut genetic link. If there is a late onset around 70s like that, or 80s, then it just means like, degeneration. It's because of the old age. It's sporadic in nature. Okay. So why early onset is linked with genes like, inheritability? Because studies have found that mutations. See, uh, so it's not the disease, it's the genes which, carry the mutations we inherit. Okay, and these mutations trigger the you know problems or damage or whatever is in our body. Okay, so studies have found that mutations in particular genes increase the likelihood of plaque and these tangle formations, and in turn will lead to Alzheimer's disease. Okay, so apparently some families transmit these mutations, and because of which the onset of disease gets set into motion.
But ma'am, what if the person is already, I mean, like, actually my amma got is suffering with Alzheimer's,
Hmm.
and thing is that, like, even sometimes we do forget. I mean, like, not uh, small things we forget, but she's suffering with Alzheimer's since 5 6 years, but she don't even recognize. Sometimes we have to tell our name, then she'll recognize.
Yeah.
But, that is that she is suffering with that because of her age. But how come it is our genes is already formed? That is that the Alzheimer she is suffering is she did not get it. Our her family history is nowhere related with Alzheimer's. Everyone are perfect, but I don't know how Amma got. But now
So
this
that is
is
what I'm telling you now. There are two types. Early onset, see, it's not a guarantee. Research are saying, okay, and they are saying it appears that there is some genetic, it appears that there is a genetic link if the onset is early, that is before 60s like that. Okay, what is your mother's age?
uh 68 somewhere around, ma'am.
Yeah, so
68.
after 65, it will be late onset, isn't it?
Late onset. But what if like,
So
God forbid, like, if
so late
we
onset, it's not every time there has to be genetic, isn't it? See, so this late onset, the disease, usually it will be a combination factors. Okay, so environmental, the type of lifestyle we live, okay, and genetic. So
actually how
combination can play a role.
okay. Actually, how Amma got, Amma got a cyst in her brain. So while removing that, doctor suggested us, like, if we go operate this, and she'll be losing a part of memory. So since then, she, I mean, like, uh, it has been increased. Like, Alzheimer's has been increased. She forgets her name sometimes. She forgets in which place she is in. Though she is in Hyderabad, she tells
Mhm.
that she's in our native place.
Mhm.
So likewise, it has
So
been
that is
increased.
because of some injury, isn't it? Some part of the brain got damaged, and the functioning. It could be that the part of brain which got affected was linked with her, the memory functioning. It could be that also. And all of you have to understand one thing. See, dementia and neurocognitive, all this we talk about, they are like, they are disorders of old age, isn't it?
Yes.
So, see, our body see, there will be, it's not just a brain. Our whole body starts to deteriorate with age, isn't it? See, our
Yes, ma'am.
eyesight starts to get affected as we age. Our knees, there will be knee problems. We would not be as, active as we were in our young
Teenage.
age, teenage to 20s. It is like slowly every day there is a degeneration. We are getting old every day. So,
Yes.
so the degeneration, eyesight, uh, the hearing, the knees, the bones. Similarly, the brain also starts to get old. So there is a degeneration in the brain also. Okay. So the research, there is a very interesting book. Now we don't have time actually, and we have so many lessons to cover. But the research says that, I told you one of the symptoms is there will be personality. So all of us, some form of dementia, all of us will suffer from, because we are aging, our brain will also start to age, isn't it? So,
Okay.
but they have found that, the type of pre-morbid personality we had will help us to navigate this. So if during our pre-morbid personality used to be very optimistic, cheerful, social, and even during the, so it will help you to navigate that. If pre-morbid personality had been like, personality changes. So if the person had been irritable, suspicious, or not getting along with others, so that will get multiplied after the dementia starts to set in. Okay, so lifestyle, your environment, your personality, pre-morbid personality, what type personality you had earlier, even genes, all of that, it's a combination. Okay, now how
Uh,
so
Mom,
yeah.
in my Amma case, sorry, only 1 minute. In my Amma case, is that memory loss is because of her, like, that cyst, benign cyst, or because of Alzheimer's. How can we say
I
that?
I cannot say that unless and until we,
Yes, okay.
perform a proper assessment, take proper history. Okay, so
Okay.
you have to go for neurocognitive assessment and, consult a neurologist, or so. Alzheimer's. Who diagnosed her as having Alzheimer's?
Sorry, ma'am.
Uh, Doctor might have diagnosed her as having Alzheimer's. Who
Actually,
diagnosed? He gave. Who gave the diagnosis for Alzheimer's?
Apollo doctor, ma'am, I did not remember his name.
Hmm.
But she got operated, and that cyst has been removed in 2013 and 14. Actually, she got operated twice. In 2013, they have extracted, but it has been size has been increased again. So in 2014, in the span of 6 months, she again operated a
Hmm.
second time. So since
Hmm.
then, it has been our memory power has been like decreasing. So
Hmm.
is that because of the memory? I mean, as per doctor said, is that because of that, or it has affected because she's like, after 65? Is it because of Alzheimer's, or the part of brain has been damaged? That is the reason she's forgetting. That is what my doubt it had. Okay, it's okay, ma'am. By seeing the reports, you
See,
will be able to tell
we
that.
cannot, like, one thing is, see, there has been her, some bit. So the symptoms could be like, as you said, there is a case, I mean, she was operated, okay, and because of which there might have been some sort of injury or damage might have
Okay.
occurred, or it could be that some part of her brain, might have gotten affected, and which could have triggered uh, the problems in her memory. That
Okay.
could be, you know,
That might
I
have,
feel like that might have, because if you're saying that, after the operation and all that, then these symptoms started to occur. That's what you're saying, isn't it? The symptoms
yes.
were not present before the operation.
No, no, not at all. She was very much fine before
Okay.
that operation, but only
Hmm.
eyesight was deteriorating little less.
Hmm.
So
Hmm.
the doctor said because of that cyst, she is unable to see properly. So we
Hmm.
need to extract it. Before that, 3-4 years research has been done by brother, and then he went for operation.
Hmm.
Okay, sorry
Yeah.
for eating up your time, ma'am. Thank you.
Okay. So we were coming to causes. So, and one of another cause is it could be because of brain structure might also be related to Alzheimer's. So they have found that certain brain structures seem to be especially important in memory, that is prefrontal lobes, temporal lobes, and diencephalon. So these structures of brain are very critical in terms of our short-term memory. Okay, where we transfer information from short-term memory to long-term memory, and how to our information, like the hold of wherever information. So temporary lobes, they are responsible for holding information temporarily, and then how we work with that temporary information. Temporal lobes and diencephalon is responsible for shifting information from short-term memory to long-term memory. So research has shown that cases of dementia involve damage to or improper functioning of one or more of these areas. I think, Sarita, isn't it?
Yes, ma'am.
Uh, yeah, I think I've answered your question just now. So
Sorry.
if there is damage to either prefrontal lobes or temporal or diencephalon area, so the cases where damage occurs to these areas, it can lead to it can lead to, uh, you know, uh, it can trigger a dementia. Okay. So the cases of dementia involving damage to prefrontal lobes, temporal lobes, or diencephalon.
Okay.
Okay.
Okay. Okay, ma'am.
So that might have happened with your mother.
Okay, ma'am. Thank
Okay.
you.
So cases of dementia, cases of Alzheimer's, where there is damage in these areas can trigger this. So
Okay.
there might have been damage in these areas of our brain.
Okay. Thank you, ma'am.
Yeah.
Ma'am, can you please
So
tell that book name you were telling in between? One famous book you were telling, and
no,
you stopped.
abnormal psychology by book name. I know. I'm not. Which book name did I say?
No, you did not say anything. One famous book you said, and then you stopped. You did not even tell the name, or neither the author
I
nor
don't.
the book name.
I don't remember. I'll have. I don't. I mean, just slipped my memory. So maybe I'm also aging. Okay.
No, ma'am,
So
no. Thank you. It's
okay.
okay.
So another other explanations for dementia is, another explanation is the autoimmune theory. So they say that changes in aging brain cells may trigger an autoimmune response, which can lead to dementia. That is, I'm sorry, Alzheimer's. Okay. So what is autoimmune illness? Autoimmune means your own body starts to attack its own cells. Okay. So changes in brain can trigger an autoimmune response in the brain, which in turn can lead to disease. And final explanation for Alzheimer's is viral theory. So they have found that, because Alzheimer's disease resembles, there is one more form of dementia called Creutzfeldt-Jacobs disease. It is a form of dementia caused by virus. Some researchers propose that maybe a similar form of virus or similar virus may also cause Alzheimer's disease. But till now, we have not yet identified no such virus has been detected in the brains of Alzheimer's some researchers might believe, because one type of dementia is triggered by a viral infection. Okay. So, how do we assess or predict Alzheimer's disease? So, brain scans are usually used as assessment tools and provide clinicians with confidence in the diagnosis of Alzheimer's. Okay, so scanning of the brain, uh, helps us in diagnosing Alzheimer's disease. And what are the interventions? The most effective intervention for dementia are those that help prevent problems or at the very least are applied early. So it is essential to have tools, especially assessment tools to identify the disorders as early as possible. Okay. So treatments for cognitive features of Alzheimer's have been at best modestly helpful. A number of approaches have been applied, that is, including drug therapy, cognitive techniques, behavioral interventions, and caregiver burden is very high when it comes to dementia, Alzheimer's. So, support to the caregivers, uh, and because see, caregivers of patients must deal with the uh, social death of the patient before the actual physical death of the patient. Okay. So the patient forgets everything, like even fails to recognize the family members. So there is social death before the actual physical death, and that can be very painful for the family members. And then there is financial burden, and then there is continuous chronic stress attached to being a family member of a person with Alzheimer's, which makes them at high risk. The caregivers are at high risk for depression. So, dementia disease, there is no effective treatment exists till date to restore lost functioning. And behavioral therapy works to control, see patients with Alzheimer's, they wander off. So, behavioral therapy will help them, works in helping them to control wandering, incontinence, inappropriate sexual behavior, and poor self-care behavior. Drugs that enhance the availability, increase the availability of neurotransmitter, such as acetylcholine, are given to them. And now a lot of research is being, done to maybe come up with medications or vaccines that will help to clear away these, I said, plaques, protein plaques and tangles are found in brains of people with Alzheimer's. So maybe they are like doing a lot of research that can help to clear away these plaques. Okay. So with this, we have finished with Alzheimer's. I thought, my God, I even thought I'll start with um, childhood disorders. Okay, so anyways, the last is Parkinson's. Parkinson's is another type of dementia. So, what is a Parkinson's disease? Parkinson's disease is one of the most common form of degenerative disease of the nervous system. And so who gets Parkinson's disease? It is most common in people over 65 years of age and can affect younger people as well. Patients under 40 are classified as young onset Parkinson's and make at least 10 to 15% of all cases. And so what causes Parkinson's disease? In Parkinson's disease, they have found that specific neurons in the brain start to malfunction. And because neurons start to malfunction, they start to make less chemicals, neurotransmitters, and especially dopamine neurotransmitters. And this dopamine is responsible for generating movement in the body. Okay, so when specific neurons which produce dopamine, when they start to malfunction, and then they will in turn lead to lower dopamine production, which is implicated in, which is responsible for movement. So scientists do not yet know exactly what leads to the death of these dopamine producing neurons. They're not yet clear on the reason, like the cause behind the death of these neurons. And what are the possible risk factors for Parkinson's disease? In most cases, researchers believe that Parkinson is due to a combination of genetic changes and environmental factors. With young onset patient perhaps having, again, similar to Alzheimer's, if there is a young onset, that is, onset in 40s or in young age, then there is stronger genetic contribution. Okay. So what are the risk factors is, one is your age is itself is a risk factor. If you are over 65 years of age, your risk for dementia increases. And if there is a family member with Parkinson's, then you are at more risk, especially young onset. And environmental factors would be if you have been, there has been continuous exposure to pesticides. And they have also found high dairy and milk intake, uh, mm, uh, uh, linking high dairy and milk intake towards Parkinson's. And if there has been a head injury, that can also uh, lead to Parkinson's. So your risk for Parkinson increases. So not everybody who takes high dairy and milk will develop Parkinson. It is just that they found high dairy and milk is a risk factor. So what are the symptoms of Parkinson? Parkinson symptoms can be broadly divided into two types: motor or movement related, and not non-motor symptoms. Non-motor symptoms might show up earlier but can occur throughout the disease. So what are these non-motor symptoms? Loss of sense of smell, sleep problems, constipation, and depression. These are the non-motor symptoms. And some non-motor symptoms may be associated with, because of these non-motor symptoms can also be triggered because of the Parkinson's medicines itself. And those could include daytime sleepiness, hallucinations, drop in blood pressure, and psychosis. That is, the psychotic symptoms can also be observed. So it is recommended that when they start to observe these non-motor symptoms, better to inform the doctor. Maybe changing medications can improve these symptoms. So what are the motor symptoms? Motor symptoms are tremor. Tremor is not always present, but can be the most noticeable motor symptom of Parkinson's disease in many cases. And the tremor is usually in the hands at rest. So when the hand is at rest position, tremor, resting tremor, we call it as pin rolling. Okay. So tremor is usually in the hands at rest, but can also be present in legs or even the chin area. The resting tremor of hands is often described as, that is a medical term, pin rolling with the thumb and other digits. So, the rolling almost like, pill rolling type of movement with the thumb and maybe forefinger or other digits of the hand. Other motor symptoms include slow movements of there will be slow movements called bradykinesia, stiffness in the joints in the body, reduced facial expression, changes in posture, and trouble with walking and balancing. Motor symptoms usually start on one side of the body and can spread to other as the disease advances. So what are the stages of Parkinson? There are a variety of rating scales which are used by specialists to track changes over time. And doctors sometimes divide Parkinson's into 5 stages. And progression is typically slow but can vary from person to person. So in stage 1, there will be mild symptoms, usually includes tremor and other motor symptoms affecting one side of the body, and it leads it in the level of disability would be less. And stage 2, symptoms may make daily activities more difficult. Everyday activities more difficult. Movement problems will appear on both sides of the body. And posture and walking of the person can be affected, and disability is at a mild level. Third stage is movements are moderately slower. Balance is more affected, which puts patient at a greater risk for falling. So dressing, bathing, and doing other activities can become more difficult for these people. And stage 4 of Parkinson's disease, there will be significant mobility issues which require the use of a walker. They cannot move by themselves, walk by themselves. They'll have to use walker to move around. And patients will need considerable help during doing their everyday life activities, and they will not be able to live independently. And the last stage is